Well, hello everybody. Welcome to another one of our In Conversation series with health and care leaders from across the country and beyond. We have another repeat visit today. Rachel Power, Chief Executive of the Patients Association, is here to talk to us about the second patient experience report that the association pulled together during the pandemic. Before that, Rachel, just remind everyone about the Patients Association and your work.
Hi Richard, thanks a million for inviting me. So I'm Rachel, like you said, and I'm the Chief Executive. I'm delighted to be the Chief Executive of the Patients Association, very small national charity that provides helpline and advice services and campaigns for patient partnership in the design and delivery of services.
Well, that's great, and people tend to assume you're an enormous gargantuan organisation, don't they? Always like to make that point. You are a small organisation, but you've always consistently punched well above your weight, and of course, yeah, you're always looking for support and people can partner with you.
Absolutely. Interestingly, we just started a piece of work with some patients a few months ago, Richard, about, so our strategy that we developed last year was around patient partnership, like I said earlier, but we actually brought in a lived experience advisory panel to come and work with us so that they could be our guiding coalition in how we develop partnership working and show that how we can partner well with patients as well. And that's been an inspirational piece of work with these amazing individuals who pretty much are at risk of inequalities in accessing services due to their disabilities and their backgrounds, and wow, they've taught me quite a lot.
That's really interesting. I mean, we're often challenged as an industry to say, what are you doing about health inequalities? How are you addressing them? And it's something we struggle with. So maybe that's something else we can come back and talk about. That would be
well, we're just about to do an evaluation of the lived experience advisory panel, and they have just renamed themselves Patient Voices Matter, and they want to make sure that they are the voice of patients. And actually we had Bola, who's the director of inequalities, in to speak with the group last week, and so that they were able to tell her their personal experiences. And it'll come up when we're talking a little bit about the report that we've just done, but so much of it's just about how we communicate with each other, and that understanding the needs of the person, and at all times putting the patient first and foremost in what matters to you as an individual.
Great. Okay, well, you mentioned the report. So last time we spoke together and people got a chance to listen and watch this, it was your patient experience report, and you've kind of updated that, as I understand. So we now have patient experience before the Omicron wave, the storm before the storm, which I think is a fantastic title. And just tell us a little bit about where it came from and some of the key headlines.
So one of the things that I wanted to, we've done quite a few reports since I joined the Patient Association, but what I wanted to do is to start looking at how did we do a tracker report so that we can measure, hopefully as we come out of COVID, an increase in access and an increase in satisfaction. But we weren't in a place last year to start the tracker. And so I still wanted to hear more. We hear through our helpline and we hear through our focus group work what patients are experiencing, and we hear through our lived experience advisory panel, but I just wanted to know more about what was actually happening out there at the moment. And so we launched and we said we'd do something really quick so that it was quite valid, so that we could write it up and report it pretty quick as well. So we launched our patient experience survey, and we asked patients to tell us about their experience of health and social care. And we launched it at the beginning of December, and then Omicron hit. But what we were able to do was very much look at the data that we had, because the first few weeks have been the busiest, so that the data was not as a result of Omicron hitting. It wasn't as a result of primary care being pushed into booster and all of that. This was pure patient experience, and that's why we called it the storm before the storm, so that we could. But it made for some really dire reading. What we found was that 2 out of 3, so we had about 1,000 patients complete the survey, and we found that 2 out of 3 lack confidence that the health and care system will be able to continue to deliver high quality care consistently after the pandemic. But I suppose one of the key findings in there was that those patients who are living with with conditions that affect their ability to live their day-to-day life, they were the ones who were finding it hard to get the information they needed to keep well. Now, you talk about inequalities earlier on, Richard. These patients probably are people who are so used to communicating with the NHS and the system, and yet they were finding it hard to get the information that they needed to stay well. So one and two said that they hadn't been able to access the services they needed, and again, GP appointments were a struggle for patients to access face-to-face GP appointments. But I suppose the other two kind of key, really upsetting stats for me were that 1 in 4 patients disagreed that they had been treated with respect, and 1 in 4 patients felt that they hadn't been listened to.
Okay, that's some, as you say, there's some worrying things in there, aren't there?
Yeah.
So I think you published that on the 27th of January. We're recording this on St David's Day on the 1st of March.
Yeah, happy St David's Day.
Yes, and to everyone else who goes in for that sort of thing. Yeah, we won't talk about rugby at the weekend.
Sorry about that. We can't talk about rugby at the weekend.
Maybe next week after next time. What are plans now? You said this is a sort of a tracker survey. What are the plans?
No, this was just a one-off. So we are going to launch a tracker survey in June, and we'll be doing it biannually. We're just putting together the information on that and how it'll run, because we need to get a wider selection of patients for the tracker survey. So that'll hopefully launch in June, but we'll let you know.
Well, it'll be fascinating to see how that plays out from emerging, as we hopefully are. We were talking before, hopefully emerging from the pandemic. And I mentioned, if I was on a call with the hospital I served this morning, looking at our performance and activity, and we obviously were looking back always, and we looked at January figures, and they were challenging. There were challenges still with COVID affecting staff, and a lot of staff still. So I mean, waiting lists continue, don't they? We've got an enormous problem to try and tackle in the months and the years ahead. And we were talking before offline about the recovery programme, and the sense, I think you have to hand it probably to the Secretary of State. He said things are going to get worse before they're going to get better, but there's no doubt we're going to have an awful lot of resource thrown at trying to get those waiting times down between now and May 24, when there's a small matter of a general election. What's your general outlook on you think the way things are heading, Rachel, particularly from a patient's perspective?
I don't think that, the waiting lists are going up, and they will go up, like you said on your meeting this morning. And there is no magic wand here. But I suppose for me, we've quite a few recommendations. But the one thing that's missing here is a fully costed and developed workforce plan. We need enough doctors and nurses to be able to provide the care for patients. So we've issued a lot of recommendations on how the NHS across the UK can help patients, and what we need to do is have better partnership with patients. We worked with NHS England back in January of 2021 in the development of communication and good communication with patients while they're waiting for care. And we were delighted to see that they were referenced in the elective recovery plan. But it's still not happening. We need those waiting for care need to be given the support to help to remain as well as possible while they're waiting. And we've done quite a lot of radio interviews and interviews with patients where, they're saying, actually, if we know when the operation's going to be, or that it might be in 6 months' time, but I will hear again in 5 months' time as to whether it's going to be. We just can't have people living not knowing what the next step in developing their care is. And I suppose in that we call to the government and saying that we should have a well-being strategy for the health of the nation, and that should have everyone together, from education to industry and work and pensions, all working together. So we really think that we've got to get shared decision making. and get it across the board, because we speak to people who are so passionate about shared decision making, and yet we hear time and time again from patients that shared decision making does not work. And you know, it's down to your very point of access, your very entry point of access to the NHS in how you receive your GP appointment. You know, that should be done in a what matters to you and what's going to work for you as an individual, and start from there. But I think the key thing for us and the key thing for patients is communication, and really good communication, and knowing where to go to get further information if you need it, and further support.
Yeah, that's a great point, Rachel, isn't it? I mean, it's a real challenge now with so many people waiting longer than they anticipated. Some have already been a fair way through the system already. They've had preoperative assessments, they've had imaging, and there's now a question mark whether that's still valid. At what point do we go back, and how do we interact with people in those times? That's going to be, I think, a real challenge. And a great point also about the workforce. Everybody's making the point that it's not the issue. Money probably isn't the issue at the moment. In fact, theatre capacity is probably not the issue, but workforce.
Well, workforce is a massive issue, and you know, we have to commend how hard frontline staff worked during the pandemic, but patients suffered as well during that pandemic, because quite often they were the unforgotten ones. They were the forgotten ones, in that, you know, you're sitting at home wondering about when you're going to get your knee replaced. You may not be able to go to work because you're in such pain. You then end up having to live in a different way, or use your life savings to go. You know, we spoke to a patient a few weeks ago to use their life savings to go and have it done private. That's not choice. That's because it's becoming a necessity. And of course, everyone has a choice. But and there just seems to be a lot of regional variations as well about how patients are treated, and then patients who are in hospital, how their loved ones are treated about coming in to visit them in hospital, and to be able to be with them. So there needs to be an effort to really rebuild the NHS's relationship with patients as well, because back to our storm before the storm, you know, to feel that you weren't listened to or you haven't been respected is a horrendous place for a patient to be in.
Are you at all optimistic, Rachel, about how we can make good progress there? There's obviously yourself and others doing that kind of work, and I think the way we're going to have to handle the waiting list at the moment is that relationship with the patient and continuous communication, how people can care for themselves in the meantime, is going to be crucial to that. Are you optimistic at all?
Withstanding the big issue about not enough doctors and nurses, and you know, we're a tiny organisation, it's not something that we will continually call for. And you know, there's that issue, and then there's also the issue of social care and proper investment into social care, and you know, people who are well enough to leave hospital still in hospital because there isn't a social care provision for them there, and that is a awful unfair on those people who are trying to come in to hospital and get treatment, but really unfair to that well person who is stuck in a hospital when they should be somewhere else. But I do think the bit I do feel positive about is that if we can really get shared decision making, and if we can really get patient partnership to be core in the culture of the NHS and in how everyone works, and that in turn would bring really good communication, and patients would feel informed and they'd feel an active partner, then I can feel confident. And I think that if we did have shared decision making and patient partnership, I do think that A, better outcome for the patient, which is what we're all about, but B, I think for the healthcare professional, it would be a more motivational and more satisfaction in their work. And I think actually there would be cost savings if we were designing and delivering services in the way people needed them.
Yeah, well, that's great. Sage words as always, Rachel. Just finally then, what else might we expect to see in the coming months from the Patients Association? And then just remind people how they can get involved in your work.
Brilliant. Well, people can get involved in lots of ways. You can become a member by signing up at www.patient patientassociation.org.uk. So we're an individual membership, and we are obviously, membership is free, but we run a range of different focus groups, and we really want to get people involved because we want to hear the voices of more patients and more diverse patients. So over the next few months, what you'll hear from us is our annual tracker, our biannual tracker, which we'll launch. We'll also be evaluating our lived experience advisory panel, which I think some of your members, having spoken and supported some corporates in designing patient panels, there'll be a lot of learning coming out of this. And we've done some work, and I'd love to talk to people more about it, is around how to make sure that you have a really diverse patient group supporting you in your work, because we need to get to those voices of people who haven't been heard across industry, across the NHS, and at the Patients Association. You know, we're on a huge journey about that, but you'll see the evaluation on there. We're hoping to run a couple of events. We had a really good event last year, towards the end of last year, on shared decision making, and we have a lot of recommendations there, and we're really trying to do a piece of work at the moment, if people want to help support us with it, is to understand the barriers when you are working as a healthcare professional to do true shared decision making, and why it's not working across the board. So that's a big piece of work that we want to do. And then the other bits, the helpline will continue, and we'll be, our corporate partners come to briefings with us, so we update you on what's happening in the NHS from a patient perspective. But we can be in touch again soon, so there's lots coming from us. We're going to have a really busy year. It's already a busy year, but it's been delightful to talk to you again, Richard.
It was right now, and likewise. So everyone who's watching and listening to this should be a member of the Patients Association.
Yes.
It's free, and there's also so much good stuff to go there. And we will speak again, Rachel, and we look forward to.
Just get in touch with me directly. Anyone that wants to talk about what we do, are happy to talk about what we do.
That's great. Thank you so much for your time, Rachel, and we'll speak.
Richard, thank you for all your support.